Thanks for joining us. We've designed this series of YouTube videos to help you navigate the complicated world of PQRS and value-based modifiers. The Physician Quality Reporting System, known as PQRS, started in 2007 as a voluntary program. Providers who participated could earn additional bonus money from Medicare. Beginning last year, the program became mandatory. If your providers don't participate, you'll see reduced Medicare payments in future years. But wait, there's more. A new program called Value-Based Modifiers provides additional penalties for practices with 10 or more providers who don't report PQRS quality measures. And the program is expected to expand to all practices next year. So what's the government trying to achieve here? We've all heard the statistics that compare the U.S. to other industrialized nations and find us wanting higher costs without better outcomes. Essentially, the Medicare Quality programs, which include PQRS, the new value-based modifier program, as well as similar programs aimed at hospitals and other healthcare settings, are all trying to move the cost curve by changing from a system that pays solely based on volume, the more you do, the more you're paid, to a system that has a focus on value, how much your efforts actually contribute to improving patients' lives and health. While it's useful to understand the long-term goal, it's the immediate impact that focuses everyone's attention. So let's look at a couple of examples to understand how these programs can impact your practice. Dr. Smith is a solo family practice provider with about $500,000 of annual revenue from Medicare patients. If Dr. Smith did not participate in PQRS in 2013, he'll lose $7,500 in 2015. If he doesn't participate in 2014, the decline increases to $10,000. In 2015, we expect that the value-based modifier program will apply to Dr. Smith, and he stands to lose an additional $10,000 in 2017. If Dr. Smith is also not participating in the EHR incentive program, which most of us call meaningful use, see additional penalties shown here by the blue bars. Let's look at a second example. Dr. Jones is an orthopedic surgeon with 4 partners. The practice employs 2 PAs and also has a PT service with 3 therapists for a total of 10 providers. Medicare revenue for the group is $10 million. Here's what it looks like with the PQRS and value-based modifier penalties, and the full impact if the practice also fails to participate in the meaningful use program. As you can see, the combined impact of these 3 programs can be substantial. In our examples, Dr. Smith, the solo primary care provider, could lose up to $35,000 a year by 2017. Dr. Jones' orthopedic practice could lose $575,000 per year. Now it's your turn. Pause the video here and click on the link below to enter your own practice's Medicare revenue and calculate an estimate of the impact for your providers. Once you've completed this exercise, you're ready to move on to the next short video, PQRS concepts.